CEO of Ontario Health, for joining me today. Ontario, like many other provinces and jurisdictions around the world, is in the midst of the third wave of the COVID-19 pandemic. Driven by variants that are more transmissible and more likely to lead to hospitalization, this wave has proven to be much more difficult to deal with. Our government continues to use every tool at our disposal to address the challenges facing our hospitals. This includes redeploying staff to where they are needed most, transferring patients to alternate hospital sites in surge situations to maximize system capacity, and ensuring that our hospitals have the resources required to provide care for patients. These have not been easy decisions, but they are necessary ones. Today, we are taking further action by temporarily amending an emergency order to ensure hospital beds are available for COVID-19 patients in need of urgent care, while ensuring every patient is able to receive quality care in the most appropriate setting. This temporary emergency order will provide hospitals with the flexibility to transfer certain patients, those whose doctors have determined no longer require hospital care and could be better supported in a more appropriate setting, to a long-term care or retirement home. This would be done in only the most urgent of situations, when a hospital is at risk of becoming overwhelmed. We will ensure patients or their substitute decision makers will have the opportunity to be actively involved in and consent to their transfer. Hospitals may rely upon this order only when absolutely necessary to respond to a major surge event and when the attending physician is satisfied that the patient will receive the care they require in their new setting. I want to emphasize that these patients are often waiting to receive care in another setting. The most appropriate care for them is not always in a hospital bed. These transfers would only be made when medical professionals are confident they will not compromise the patient's medical condition and after a full consideration of any ethnocultural or language concerns. It's very important to note that this would be a temporary transfer and that any patient who is transferred to a long-term care home that is not their first choice will continue to maintain their place in line for their first choice. In addition, our government has waived the copayment for patients who are being transferred to a long-term care home or a retirement home until they can be placed in their first choice setting. Every effort will be made to ensure patients have been fully vaccinated before being transferred. And every effort possible will be made for any transfer to be as close as possible to the patient's family. This was a very difficult decision to make. However, the consequences of not doing so could be devastating if we don't have the hospital beds we urgently need to care for the growing number of COVID-19 patients across the province. Our government's top priority has always been ensuring the health and well-being of everyone in Ontario. We will continue to ensure patients are receiving the appropriate care in the safest setting. Thank you, and we'd be pleased to respond to any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Lorenda Redekop, CBC News. So how are you deciding who will be sent to a long-term care home? I mean, we've heard so many criticisms throughout the pandemic about the type of care that people have received in those homes.
Yes, I think I'm going to ask Matt Anderson to address that, the CEO of Ontario Health.
Thank you, Minister, and good morning, everyone, and thank you for the question. So I think what we might want to do is just take a step back and understand the process for this. So right now, today, we currently transfer patients from hospital settings into long-term care. What we're talking about is in this really extraordinary time of pressures on our healthcare system, are there ways in which we can increase that flow of people going from hospital beds into a long-term care or a retirement home? In terms of the people themselves, they'd be people who are already identified. They've been designated by their medical team that they are stable and ready to be moved to another setting. Oftentimes what has happened is the setting of their choice does not have a bed available. And what this order does for us is enables us to talk to the patient and their family, but would they consider moving to another setting, another home perhaps, not their first choice home, but a home that would absolutely be able to provide the kind of care that they need. What we do at Ontario Health through our home and community care team is work with the patient, the family, the hospital, and the long-term care operator to get a match, to make sure everybody is comfortable, and then we would make the transfer. By doing so, trying to free up as fast as we can, all the while being respectful of this process, beds within our acute care facilities to try to accommodate the growing demand on our emergency rooms.
Follow-up?
To another topic now, onto the sick pay. Minister, your government came out with its plan yesterday to basically tag on to the federal program. It appears the federal government is saying they're not interested. People have been asking for a sick pay program for months now. So what are you going to do?
Well, I know that Minister McNaughton is working on that very hard because we know that there are gaps in the system and that people are not receiving a level of pay that is appropriate for them. And so I know Minister McNaughton is continuing his conversations with the federal government because we all want people in Ontario, in this case, to be able to take sick leave if they need it and not come to work if they have some symptoms, that we want them to be able to receive the care that they need to be tested, and if they need to be vaccinated, that they need to be able to take that time to be able to do that. So I know that Minister McNaughton is working very hard on that right now.
Next question.
Colin DeMello, CTV News.
Hi, good morning. So just on this new order, so if a patient says no, they don't want to move to a particular long-term care facility, will that be honored? And once they arrive at that facility, how is Ontario Health or the ministry guaranteeing standards of care?
Well, first of all, every effort is going to be made to speak with the person and with their family to obtain their consent. There may be some situations, but they will be extremely rare, where a transfer might need to be made without the patient's consent. But what is really important is that the person would not lose their first place in line for their first choice. They wouldn't be required to make the copayment, and it would deem to be medically appropriate for them to be transferred to a home that will be able to manage their concerns. So we need to consider every aspect of the person's life. It wouldn't be appropriate, for example, to send someone who only speaks Cantonese to go to a purely English-speaking place. We need to have the right match, and that's why every effort is going to be made to speak with the person and with their family to find the right match and to, first of all, obtain their consent. Obviously, that needs to be done respectfully. And it's not just a one conversation issue. This is something that may take some time, and that will certainly be honored.
Follow-up?
Thank you. And I'm wondering if Mr. Anderson or Ms. Elliott, could you give us an update on the Canadian Armed Forces? Do we know which hospitals they're going to be deployed to, and specifically when?
Well, we do know that we are going to be receiving some assistance through the armed forces. That I know that the team that has come from Newfoundland is at UHN, but I would have to provide you with details later once it's been determined the exact number of people that are coming from the armed forces and when they will be arriving. That has yet to be determined.
Next question.
Jeff Gray, Globe and Mail.
Oh, hi. Thanks very much. I wanted to ask, just to make the distinction clear, that we're talking about moving people who we're not talking about taking anyone out of critical care, out of the ICU against their will. We're not talking about the triage protocol that so much has been written about.
Oh, no.
And how close are we to that?
what we're doing, we have not activated any triage protocol in Ontario. What we are doing is creating more space in our hospitals so that we can continue to treat patients who are coming into hospital with COVID who need to be in intensive care, or people who have non-COVID related health problems. So no, we will not be moving. The people that we're speaking about are people who are already deemed ready for discharge. They don't actually need to be in hospital. They're there waiting for their first choice of long-term care home. So that would be the group of people that we're speaking with, but Mr. Anderson may have further comments on that.
Nope, you got it exactly right.
All right.
And to follow up, then I wanted to ask, I guess, about how the numbers are looking as far as the capacity surge. Are we seeing anything encouraging at all about any leveling off, any sign that the surge is beginning to taper a bit for us?
We see the numbers have been coming down in terms of COVID cases coming into our hospitals. However, we still have a strain in our intensive care system. But I would ask Mr. Anderson to add his comments because he deals with capacity issues on an hourly basis.
Hourly, indeed. Thank you, Minister. So, yes, I think that there's some encouragement. The case numbers do appear to be flattening. I think later this week we're going to get an official update from the science table, and I'm hoping to hear some good things there. So please, everybody, continue to stick with the public health measures, continue to stay home. It does appear to be making a difference. What Minister Elliott is also referring to, however, is that there's a bit of a lag. We have to see the case counts come down first, and then we will see the impact in the ICUs and in hospitalization. And that time lag can be about 2 to 3 weeks. So we really need to get that case count down. On an encouraging note, the growth in our ICU volumes and in our hospitalizations, it does continue to grow, but that also seems to be slowing, which we do hope is a trend that we're going to see and is directly related to a reduction in case count. So we're all looking forward to an update later this week.
Last question, unless someone else joins the queue.
A reminder to press *1 if you have a question. Next is Adele Loisel at blackbirdnews.com.
Hi, thank you for taking my question. What I wanted to ask was, theoretically, could a patient end up in a community far from their family under this protocol?
Theoretically, but practically speaking, we are making every effort. If we did need to use this emergency order to make sure that anyone that would be moved would be close to their family or to their first choice of long-term care home. We know that this would be a very difficult thing for people and families to deal with, and so we would make every effort possible to ensure that people would not be moved far away from their families.
If I may just add one additional comment, this order is not going to be applied across every hospital. This is specifically in the case where we have a hospital and a community in what's defined as major surge. To the minister's point, we're going to be very, very cautious about using a tool like this. And really, our purpose is to work with the families to try to open up some more capacity. And generally speaking, when families, they respond extremely well when we talk to them about where we need to go. So this is just a measure good to have on the books, but probably not something that we would need to use. And if we did, it would be very, very focused in those areas and those communities that are experiencing major surge.
Follow up, and this is the last question.
Yes, I guess you mentioned, Mr. Anderson, that we're seeing a flattening of the numbers, that the growth in hospital and ICU rates is slowing. So why do this now?
It's important that we consider every eventuality, and these numbers, while we're very optimistic, we do not have an updated forecast. In the forecast that we received 2 weeks ago, we would still see a considerable amount of growth in our hospitals. If this tool is never needed, then that's great for everybody. The minister has provided tremendous leadership by putting this on the books and making it available. Minister Elliott has spoken to me several times. She doesn't want this used. We don't want it used. But at the same time, if the forecasts stay, we are in a lot of pressure in our hospital system. It's important to have it hopefully it'll never be used.
Thank you, everyone.